Welcome back. I'm glad you're still with us here on Morning at NTV. My colleague Stephen Mbide there bringing you the sheer plight and condition of that road in Old Kampala. We do hope KCCA can work expeditiously to ensure that loss of life is not occasioned upon any road user on account of flash floods and inability to see where the patch or the potholes are. Let's now take note of multi-speciality healthcare services. I'll be introducing my guests very shortly, but our preamble first. The demand for multi-speciality healthcare in Africa is growing exponentially owing to the rapidly growing middle-class communities that are able to spend and seek specialized treatments that are not readily available in public healthcare facilities that are grappling with underfunding from the government. For Ugandans, much of these services are sought in countries including India, and key players there are now seeking to bring these critical services closer in an effort to enhance accessibility as well as affordability. We are joined on set by Pankaj Kumar, the head international marketing at Amrita Hospital in Faridabad, that is in Delhi, and we're also joined by Pankaj Chandna, the co-founder of Vaidam from Amrita Hospital, still in Faridabad. The gentlemen will be talking to us about Amrita Hospital, but most importantly about the specialty services. You're most welcome to Morning at NTV.
Thank you, Chris. Thank you.
Let me begin with Mr. Kumar first. Tell us about Amrita Hospital and why you're making inroads into Uganda in particular.
Yes, hi, good morning. My name is Pankaj Kumar and I represent Amrita Hospital in Delhi, NCR of India. Amrita Hospital is in fact the largest private multi-speciality hospital of our country. When we say largest, means it's got 2,600 bed in a hospital and it's got more than 60 operation theaters only. We are run by an organization which is a not-for-profit organization and an academic organization in India. So the intent of our hospital is to spread knowledge, to update into the medical field and to make the high-end international level services in healthcare accessible to people across the borders, across the country as well as the borders.
Okay. All right. So this is, I think, is the collaboration that brings Vaidam.com on board. I see medical travelers. Who are medical travelers anyway?
So Chris, we started Vaidam as a platform about 9 years ago, and we realized that there are people of different needs who want to travel outside their country for medical reasons. Someone is traveling because the health is not available. Someone is traveling because they are uninsured in their country and they can't afford the healthcare present in their country. Someone is traveling that although there is healthcare and it is free, but there are long queues and they don't want to wait for 6 months to get their surgery done. They don't mind paying. So everyone has a reason to travel, and that's why some of them choose Vaidam as a platform to travel wherever they want to go. As a company, we not only help patients to make healthcare accessible only in India. We have been sending patients to Turkey, Germany, Thailand, Dubai, and many places. In fact, from Uganda also, to give you a perspective, we have received inquiries not just for patients looking for treatment in India. There are young females looking for cosmetic surgeries in Turkey, your high VIP politicians, or any senior entrepreneurs, businessmen looking for treatment in Germany. So we have been handling those requests, and our association with Amrita is very focused, very strategic for Uganda as a market.
Okay. Allow me to stay with you, Chandna, on that. When it comes to medical traveling, connecting the patients with the professionals and who might be the best possible fit for the treatment of the ailments that they're grappling with. How is this done? Is it something that is sourced online? How do you connect the best surgeon to the patient that needs that surgeon?
Right. So what happens, like when we started as a .com, Vaidam.com, and someone is searching online best cancer centers in Delhi or best gynecological procedure for my mother in Turkey, something like that, and they get in touch with us. Then we have team which are trained medical professionals who then talk to patients, get their medical reports, understand what is the history, what the patient has done done so far, what do they want to achieve, and then we gave them choice of treatment, that for your problem, this is what you are looking for, this is how your recovery or your post-surgery life looks like. Don't expect this or expect this, because sometimes, you know, medical problems are not that simpler anymore. Some of those problems unfortunately cannot be cured 100%. They only have to be managed, and you know, our job, our responsibility is to counsel them, guide them, show them what they are getting into and how the life looks like going further. And then once they decide, okay, I like this choice, I want to move further, and then we help our patients with the visa process. Once they share their arrival details, we arrange for airport transfers, accommodations. Many of the patients we receive need assistance on ground, physiotherapy, and there are so many things like that. That is why having a physical premises here, which we are doing with Amrita Hospital, helps local population to streamline and make it more convenient to access that journey.
Okay. Kumar, the demand for highly specialized treatments, like I said earlier, in Uganda is increasing.
Correct.
And it's centered around procedures including kidney transplants, IVF, as well as infertility treatment. I think that's pretty much IVF. What is your scale and affordability when it comes to these services?
So we are here to collaborate with the healthcare fraternity of Uganda in building the healthcare capacity of the country. So we intend to do it in multiple approaches. One of them is obviously the knowledge exchange programs that we intend to initiate, wherein the specialists from India as well as the Ugandan doctors community would interact with each other to have an understanding of what all is existing right now in the country and what needs to be done, and what is the current clinical updates, what are the current technological updates which exist, and how can it be introduced to the country. The second way we intend to do this is introduce the super specialty OPD camps in the country, wherein we in future might have the super specialists in different specialties, be it cardiology, neurosurgery, transplants, like you said, visiting here and screening those patients and understanding the need of those patients who require the treatment, which eventually will end to also introducing the surgical specialties here in the Ugandan hospitals. We intend to collaborate with the Ugandan hospital and start some of those high-end super specialty surgical centers here in Uganda. So, like you said, even for the high-end procedures like those of transplants, we can bring in our technology, our expertise, and may end up building a transplant center here with one of the hospitals in Uganda.
Okay. Interesting development there. Now, research into critical interventions. As a country, there is need to identify exactly what is the main driver, for example, of particular ailments or infections. I do not know whether this is part of the training that you're talking about, but as Vaidam.com, the professionals that will provide this service here in Uganda, if they are to be resident, then that would be perfect. Of course, the collaboration will be, but in case it is specialized, as in the one that goes beyond the available technologies here, how is that going to work? Is it going to be done on the same terms as would be done in Uganda, or somebody will have to fork a little bit more money?
Okay. So, as my friend Pankaj was saying, so the collaboration that we are seeking with Ugandan healthcare is multifold. One of the things which, as he was saying, we will be doing is bringing doctors from India here for the capacity building, knowledge transfer, technology transfer. Same ways, we will also welcome the doctors and healthcare professionals from Uganda to travel and welcome them in India so that they can experience, do a learning and training and development program. When it comes to doing things here, as you know that there is a communicable disease and there is a non-communicable disease. So as you were just mentioning that the middle class of Uganda is growing, so the disease pattern is also changing.
That's right.
Now, the need for specialized surgery is increasingly more as compared to the 50 years ago communicable disease like TB and others. Now, when you have to do such specialized interventions like cardiac surgeries or cancer surgeries or kidney transplant or liver transplant, yes, there is expertise of the a doctor, second there is a technology, then there is process. Everything has to come together. It is not just we bring one doctor and things will start. There is a technology capacity has to go. Not just the doctor, the nursing, the anesthetist, the intensivist, everyone has to be part. To give you an idea, we recently started a liver transplant program with one of the largest hospitals in Tanzania, Dar es Salaam. There was a team of 30 people who traveled and who did this learning and development program in Dar es Salaam for liver transplant. So it's not just one guy traveling and doing something and coming back.
All right. Do you have camps for those that can't afford certain treatments that are availed either as part of corporate social responsibility? I think this is a question for Kumar.
Yes, so to tell you about Amrita Hospital and its background, we actually come from a charity organization. So the principal organization is a charity organization.
That's right.
But we opened up corporate hospital because we understand for bringing in most advanced and world-class healthcare infrastructure, it cannot be free. There has to be some expenses. So we charge minimum. We have programs in India for our citizens, wherein for people who cannot afford, since we are a not-for-profit organization, for people who cannot afford, we have programs that they've been treated by funds given by government, or if not given by governments, for our organization as well. And obviously, yes, we would. Our founder has a clear mission to get these services reached to as number of people as possible, and especially those who fail to afford these services.
That's right.
So obviously we will have some programs in future when we'll be reaching that part of population who have affordability issue, and yes, we'll be doing some charity camps here.
Okay, all right. Thank you very much, gentlemen. Lastly, about the launch of the facility, that's tomorrow, right?
Yes. So tomorrow we are doing a small ceremony where we have invited some healthcare partners, doctors, insurance companies, and everyone allied. So giving them an awareness. A doctor from India, a neurosurgeon, is traveling, so he is going to give an update about the latest advancement in neurosurgery. So that's why we have invited some local neurosurgeon as well, so they have an opportunity to understand what things are being carried out now, because medicine, as we know, is changing not every year. I can now say probably every week.
Every week, yeah.
It is.
Okay, thank you very much, Pankaj, Chandna, and Pankaj Kumar, Senior Manager International Relations, and you are the founder at Vaidam Health, no doubt. That will do it for our TechNote interview. Please do stay with us if you can, because what's coming up is about dance as a hobby, but also as a professional activity, the social demographic correlations of modern dance genre as well as preferences.